sometimes it's easy to brush it off, right? Like, oh, they don't know what they're talking about. They're just a whiny patient. They're a PETA patient. All those awful names that we refer to people who just kind of are a thorn in our side. And yet, perception is reality, and that is their reality. And so I think that it is important to take that feedback, to read through your Google reviews. And while I recognize that sometimes it's really tough because it hurts our feelings, it might hurt our ego, or maybe it's one of our amazing team members that they might have had a rough day. I think that we have to create an environment where we're open to feedback and where we're willing to try something else. Now, I've seen people probably take it too seriously and they let one patient complaint completely change their operations. And I think that that's not healthy either. And so I think that there's a nice balance. So I would ask myself, am I getting this feedback consistently? Is it something that, was it just a bad day, or is it happening over and over again? Like, are we having patients that are constantly upset because what we build them is not what we had treatment planned for them? Do we need to look backwards at our system and figure out how to treatment plan better? Do we have the right feeds and the codes? It's like swimming upstream to figure out if we can fix it. And then sometimes knowing that we do the best that we can, but we might occasionally have that negative feedback. And how can we take it in a really healthy way? So don't ignore it, but also don't change everything over one person. Be mindful of it and look into it and see if you've got something, that's affecting multiple people, because there is this like general rule of thumb that if one person says it, there's probably nine other people that have experienced it. And so how can you take that and do more research before like this whiplash of changing everything?